Hi, my name is Megan, and this is my video on my philosophy on healthcare, my philosophy on nursing, and being on camera and posting this online is not my idea of a great time. So I'm in the same boat as many of you. And if I have to look at my notes, please forgive me. I'm not so good at winging it, and I feel like I'm back in speech class, and I will probably have night terrors tonight, so here we go. I'm an oncology nurse, and positively love my job. I might have to remind myself of that tomorrow if I have a bad day. Play this video over again to remind myself. But I think that healthcare is really based on personal responsibility, and if it's not, it probably should be. I take responsibility over my health and my body and my mental health, as well as my physical. Many people keep talking about holistic health, and I think that that's all up to us in order to to maintain. So I am very cautious with foods I put into my body, with toxins I may be around or put on my body. I am very careful about the environment I'm in. I'm very careful. I am fun, by the way. I am very careful about the people I'm with, that's for sure. There's a lot of risk factors there, and I just take health pretty stinking seriously. My patient's health, relies on me being healthy, and I think that's a big part of nursing. So I'm pretty cautious, and I work with a very vulnerable population, so everything I do, has an end result, good or bad. We all have been through many, many science classes, and every action has a reaction, and I kind of view that as the basis of nursing, as the basis of healthcare, is that, you poison yourself over and over and over again with certain things, and there will be a reaction. And that's not to judge, it's just a fact. I just don't believe in sugarcoating. So it certainly is not to judge, it's just to understand, I had an eating disorder for 13 years before I went to an inpatient treatment, and I certainly did some damage to my body in those 13 years, and 6 years healthy now, and healthy-ish, and it just is, it's my responsibility, and I take full responsibility for what I did, and I think that that's okay to just understand that whatever we do has a reaction. So it's up to me with my patients just to make sure that I educate them and help them understand what they can do to improve their health, their overall health. That could be, right at the beginning of a diagnosis. I go in on all new consults, and it could be, the time of diagnosis, and maybe it's just as simple as, helping him over that, hurdle of getting over the word cancer, so how to care for themselves emotionally. It's certainly not to judge them or to tell them you got this because or whatever. I mean, that's not where I'm coming from, but just in okay, so this is what we're dealing with, now what kind of idea. I really like working in oncology. My role there is pretty phenomenal. I get a lot of time with my patients, and a lot of patients that I see, once, twice a week, and really get to know and to to help, and pretty blessed there. It's emotionally pretty taxing. We get connected with a lot of patients and have to have some pretty good self-care. And there's a lot of times that doesn't work so well, but again, just the idea that I'm responsible for making sure that I care for myself, emotionally, so that I'm there the next day for the patient that comes in then. So I don't know. I think that that's kind of what's missing in healthcare right now. People look for a magic pill or a quick fix or whatever, instead of just looking at what were the causes of the problem and how do we then address those issues, and even if they're difficult to talk about. So anyways, that's me, and please be kind.